First of all, I'm glad that you're here in Bangladesh and really trying to reach blind children in their home, at their school, and wherever they're living their everyday life. I think this is something you have to really come across closely and observe and interact with those children. Then you start realizing that how our little effort, little awareness can change their life as a whole, and also it has huge impact on the families of blind children. Most of the blind children, they are in many ways hidden in the society by stigma, by lack of information, lack of awareness about the services which is available, and also lack of awareness about the ability of children who are blind.
মণিপুর কাজ থেকে পরে সে জলবায়ুয়ে মাছ চাষে ব্যবহৃত করা হয় এবং মাছ চাষে নিয়োজিত জনগণকর্তৃক মৎস্য সম্পদের
In 2004-05, we registered this organization, Child Sight Foundation, and we started working in different districts, taking a new approach which we call the key informant method. So we actually go in a village, in a community. We work with the local people whom we are calling key informant. They are the people like school teachers, imam in the mosque, or whoever in the society have a social role of leadership. And in a traditional society like Bangladesh, it actually works very well because people traditionally rely on those village leaders, key informants, and learned person in the village for all sorts of help and advice. So we contacted those key informants. We provided them with a one-day simple training how to detect blind children in their own village. And within a month, they usually come up with a list of 60 to 100 blind children in a district or in a sub-district sometime.
এই যে মোদের দেশ আহা সোনার বাংলাদেশ এই যে মোদের দেশ
This is our house.
আপনারা সবাই বলেন
মা কই মা এই যে মা
Was she identified by the key informant at all?
Yes, yeah. By the key informant method.
Okay.
And diagnosis
2 years ago, 1 year ago, when?
just 1 year ago.
Just 1 year ago?
Just starting the project.
Okay, all right.
The work of CSF actually started in 2000-2001 when I was doing a national survey of blindness in children in Bangladesh from London School of Hygiene and Tropical Medicine where I work. And during that survey, we met more than 2,000 blind children across the country, and we realized that about a third of them can regain vision if we can detect them at an early age and give them a referral system and service where they can get surgery and intraocular lens. So 1/3 of them were unnecessarily blind for cataract, which is curable with a simple 15-minute, half-an-hour surgery. One of the key elements of management of glaucoma is early detection of the problem, and vast majority of the children who get glaucoma in rural villages, most of the time they don't have any doctor in the village, so they don't get any specific advice, and most of the time when they present to a doctor, which is at the age of 4 or 5 with already damaged optic nerve, and it's too late to do anything for enhancement of the vision.
এবার তোমার তো ভালোই আছে কিন্তু আমার সামনে এসেছি
I know with the childhood cataract, that's one of the areas that CSF is really targeting. Number of children, thousands of children, like you said. So can you tell us a little about that?
Okay. Again, that baseline study we did, which provided extremely useful information for program planning. And one of the surprising findings in that study, the main surprising big finding was that cataract was the #1 cause of blindness in children. And it was 32% of all blindness was due to cataract in children, which is a very high percentage. And in most of the studies previously done in other countries, that showed about 10 to 12% as a cause for cataract. Wherever you work, in whatever aspect, try to involve people and give them the information. They will decide to act together. Most of the time, people have a tendency of convergent ideas. And when you give them the good cause and give them the skills or inform them about creating awareness, I think that makes a huge difference, and you get lots of more energy from new people who are getting involved.
Excellent. Well, I got to tell you, it's an honor to meet with you, and God bless you for all the wonderful efforts that you're doing.
It's a pleasure.
It's
Thank
amazing.
you very much.
And we hope to work with you and with ICH in the future.
Thanks
a
very much
lot.
for your
Thank you
support.
very much.